It's been 3 years since she's been getting treatments to help heal her scars, and now she joins us via Zoom. Welcome back, Eileen. How are you doing?
It's been going really well, thanks. We started out, 3 years ago after the show, and we've been continuing ever since. We go every about 6 weeks or so, and we've seen much improvement from the start of the treatment, and it's going fantastic.
So awesome to have you on. Listen,
Thank you.
when you were on the show last time, we understand that you had some difficulty watching the fire from the matches in your backstory.
I remember viewing the backstory, and when they lit the match, I remember it was like almost an outer body experience, and it definitely brought me back to basically the incidents, just the fire itself.
Yeah.
So then I just remember walking around the studio like a zombie. So then I felt like when I started talking that I might not have been making much sense, and I wasn't cognizant of even the conversation at that point because I was so in the moment of the fire.
You know, with trauma, Eileen, we can relive that, and there are triggers that can kind of bring us back to that. So what you're saying makes perfect sense to me.
I'm curious, what differences have you seen since you've been receiving the treatments?
So it's definitely, it's increased range of motion. Not that my range of motion was super restricted at this point, but there was still some restrictions. And I did notice as well, it's something that I really guess was never aware of. I didn't have sensation. And my first couple of treatments, they were burning my skin. They were lasering my skin. And I just sat there like it was nothing because I didn't have much sensation. And I'd say around the third or fourth treatment, all of a sudden I started flinching, and it was like, oh, what's this? It was surreal because I was 3 years old when I was burned. So I never really knew that I didn't have sensation there because that's all I knew. So it's pretty incredible, amazing.
I think that's so wonderful, Eileen. And I'd love to bring in the doctor who's treating you and who also happens to be a former classmate of mine from Harvard undergrad. Welcome, Dr. Snehal Amin.
Thank you very much for having me back on the show. It's great to see you all again.
Thanks so much for joining us. And thank you for the amazing work you've been doing. I'm curious, what do you think of Eileen's progress?
I think she's done really very well. And I have 3 parameters of kind of how I measure how well burn patients do in this context. So functional is really very important. So I'm pleased she has better range of motion. And that's because some of the harder areas are softened up. The collagen that's causing the tightness is actually reoriented by the laser itself. The other thing we want to look at is color improvement. So before she had really mottled skin, brown and white and red, and now it's more evenly colored. So that's really that's really because of the laser, nothing else. And then the third area is texture. The skin is softer. And that's really important to the patient. Like when you touch your skin, you expect, smooth skin in this area. And I think we're not 100% of the way there yet, but there's a great improvement in all 3 parameters.
Yeah, and I think, Dr. Amin, that's a really important point because sometimes when you look at a screen and you see a before-after photo, people don't realize with burns how much that firmness and the fact that the skin is bound down, just releasing that and making it feel softer, giving that range back, it's just so life-changing. And I'm curious, how much more improvement do you anticipate with the treatments?
Well, we can definitely see more improvement in terms of the texture. I think the suppleness of the skin is really at about 80% of where it should be. So we're pleased with that. The color can be improved probably by another 50%. It really depends on the amount of the depth of the laser we might use. And since it's such a large surface area, we don't necessarily want to over-treat at any one point in time. And so we're fractionating the treatment, so to speak, right? We're giving her little bits of treatment at a time. And since we're not in a rush and we don't want any complications to make the area worse, which is possible, everything has potential complications. So we want to be really careful and slowly achieve our goal rather than trying to, hit a home run on the first try.